you guys kind of look a little, I don't know, tired. So I think we're gonna do some window wall. So our math teacher, when he sees us kind of just lying down and not really doing our math or whatever, he tells us to get up. So can you please stand up? All right. And just to get the blood flowing and stuff.
And it also, studies show that action that crosses over the line of vision helps to stimulate the brain.
So
So
we're gonna go from the window.
window.
Window. Wall. A little louder.
Window.
Wall. Window. And wall.
All right.
Yeah. So periods. So cramps can often be painful during the pain that occurs during periods, and it's just really bad. So because of the lining of the wound being shed. So taking Advil and using heating pads is often helpful to reduce these cramps, but only use these under adults' permission, and seek your mom for extra help or someone with extra experience with periods.
All right.
Keep going.
Yeah.
Okay.
We don't need one.
Yeah, it's kind of.
Is it frozen?
All right.
We're good.
Oops.
Sorry about that.
Go back one. All right. Take the computer.
Yeah.
All right. So I'm gonna talk to you guys about the female and male reproductive system. Due to time limits, we're gonna talk about only a couple. So the seminal vesicle is a pair of glands that add nutrient fluid to the semen during ejaculation, which is when the penis enters the vagina and starts,
Well,
you know.
ejaculation doesn't have
Yeah.
to happen when
Yeah, okay. And then, so the urethra, which is a tube that connects the bladder to the genitals and removes fluids like pee or urine to the body. Alright, the testicle are two oval-shaped organs that produce the sperm. The foreskin is just the retractable roll on the tip of the penis, and then the glands of the penis is also just the tip of the penis. Also, so there's this thing, I don't know if you guys know about, called circumcision. So it's partly a religious thing, or it's said to be more healthy. And so if some of you guys, your penis does look like that, and you've seen someone else's that doesn't, don't be like alarmed or anything, because it's just you're not weird or anything. It's just different, not bad, not different in a bad way though. All right. Alright, so now onto the female reproductive system. The ovaries is the organ where the eggs are produced. The cervix is a neck-like passage that forms the lower end of the uterus. And the uterus is an organ in the lower body where offspring are conceived. The fallopian tubes are a pair of tubes where the eggs travel from the ovaries to the uterus. And then, of course, the vagina is the muscular canal that extends to the outside of the body.
Okay, so during puberty, a big part of it is emotions are going to change. That's just a bunch of hormones around in your brain, and that's going to change the way you feel. You might be feeling angry or mad or sad for reasons that you don't really know why. Don't worry, that's completely normal. Everyone goes through that. And, and mood swings are often very common. You'll just get a bunch of emotions. So mood swings, in case you don't know what that is, like you're happy one minute and then you like drop your pen or something and then you're like completely devastated. And also that's very normal as well. So ways to deal with emotions. There are a lot of, there are a lot of different ways to deal with emotions, including you can exercise, and those gets your energy out, helps you with dealing with stress, like Randy said in our pre-presentation thing back at the sanctuary.
So,
First, before we have a little quiz for you guys, but that's just if we have time for it. Is there anything that we didn't cover in here that you guys have any questions about at all? And everybody in the room, not just the sixth graders, can ask stuff too. No?
alright.
All right, our presentation's pretty good.
Alright, so we're just gonna have a quick little review. So, do you guys remember what this is? Or can you remember what this part of the reproductive system?
Tell them what it is and they can tell you what it does. It's a lot better.
Alright, well,
Doesn't really matter what it is.
that's the seminal vesicle. So, do you guys remember what it does or
What its purpose is.
what its purpose is? Eliza?
Doesn't it give like nutrients to the season?
Exactly. That's a good job. Alright, so next, the urethra. Look at- Do you remember, did any of you?
Doesn't it like release urine?
Yeah, exactly. Alright, next. The testicle, do you, I'm pretty sure this is it. Alright, Ben?
Does it produce semen?
Yeah. Alright, next. Alright, so the foreskin. Alright, that's just
Or
the,
just what it is.
yeah, just what it is.
Yeah.
Is it the stuff that covers the head thingy?
Yeah, the retractable roll of skin, right. And then the glands. Alright, that's just the head or the tip of the penis. Alright. Alright, to the female. Do you remember what the ovary is?
It's where the eggs mature.
Yeah. The cervix. Alright, it connects the bladder to the urethra. The vagina.
Okay, sorry, didn't know.
It's a muscular canal that's on the outside of the female body. Next. The uterus.
That's where like the eggs get like fertilized and where they grow into babies.
Conceive. Yeah. And then there's one more. Oh, just kidding. Alright. So that's the end of our presentation.
Alright, so, yeah, guys, thanks for watching, and you guys were a good audience answering questions and picking stuff at the board. So, again, now it's like a good time to ask any questions that you might have had. Time to think about that. So, and also, yeah, Scott?
How did it go?
Oh, it went good. I think. I don't know.
Yeah.
You guys thought about it, but yeah, I thought it went really well.
And then be sure to sign the reflection sheets as
Now,
well.
when you let us know when it's time to hand these out, we've got reflection sheets. This sheet will hold you for your feedback from all of the sessions. So whenever you're ready, we can pass these
Should
out.
we?
Maybe you got questions and everything?
Okay, yeah, sure.
We've already.
Yeah,
Thank you.
yes. Oh, sure.
So you guys, your talk was on puberty.
Yeah.
And I didn't hear much about kind of the experiences you guys have had. So can you share some of what you've gone through in puberty and how, we talked about the processes and the functions of the body and what changes are there, but emotionally, what has gone on for you guys through puberty? How's it affected you?
Well, like, it's not always about the reproductive system or the penis or vagina. It's also just everywhere. Some places that the website did not talk about. So like growing pains, one of them when you hit your growth spurt or something, you start getting taller, and maybe things you usually do, like, I don't know, play on the playground or something. Once you get taller, or when you're in the stage, it just kind of hurts just around. And then also, my voice is cracked a lot during doing that, but now it's staying at a.
Really? Because mine hasn't cracked. Oh, and then also something we forgot to mention, drinking a lot of water and getting a lot of nutrients, eating a lot of food can also help you a lot, because your body's going to be growing a lot and it needs as much fuel as you can put in it. So, you might try to be like cutting back and be like, oh, I can only eat 2 meals a day. When you're hungry, it's really important that you should probably eat something, because your body's telling you that it needs some food. So don't just be like, I need to keep skinny or anything. So, yeah.
For personal experiences, I know sweat, it's just, it starts to also have its own odor during puberty, and sometimes you have to re-lather deodorant like multiple times a day. Say you have like double PE and then track, and then you go home and so shower every day, and
Yeah, exactly. And sorry. Also during puberty, people start to develop their own kind of scent. Almost, when you're a lot younger, more of an infant. Most infants actually smell very similar. And as you get older, you start developing your own scent, and that can also help. That has to do with more of an evolutionary thing, where you can be more identifiable to a possible mate, or another tribe or group, or whatever. So.
Do you think there's difficulties in having a body that's ready to produce children and abstaining from that?
I don't really think that, since a long time ago when that actually was the case and you were having children at 14 and 15, since then I think it's just become part of our culture that you don't do that until you're a more adult or something like that.
until you
stage
reach
in
a
your
more
life.
mature
Yeah.
age.
Yeah.
I don't think it's really as acceptable to do it, but it's still,
But the body's ready to do it.
Yeah.
So you're using some of the other methods maybe to
Yeah.
relieve stress.
like exercise.
Any more questions? How do you guys think we did? Any feedback? Cool. And make sure you fill out your evaluation.